I'm extremely grateful to attend this international symposium. And I'm the associate assistant professor and the director. I'm the assistant professor in the China Medical University and the director of the Department of Traditional Chinese Medicine at Annan Hospital. It was the branches of China Medical University in Taiwan, in Tainan, Taiwan. And I'm appreciate to share my recent research about the clinical chemotherapy-induced peripheral neuropathy in patients with breast cancer. But this is a pilot study. And this kind of topic has been published in Journal of Clinical Medicine in 2021. As we know, the chemotherapy is an refractory and disabling side effects of neurotoxic chemotherapy among patients with cancer. And as the previous literature revealed, that the incidence of chemotherapy-induced peripheral neuropathy gradually reduced over time. At first, the incidence rate of CIPN is approximately 68% after 30 days completion of chemotherapy, and then gradually degradation and reduced with time, while more than 6 months, only 30% patients sustained CIPN symptoms. And those CIPN symptoms will cause the reduction of life quality and cause the neuropathic pain among those patients, may induce like disabling or discontinue the whole regimen of chemotherapy. So it's the aim and eager for us to practice our acupuncture on those patients. And those patients, the symptoms of CIPN always include tingling or pin-like sensation, and it causes pain, burning, and numbness among our 4 extremes. And it is sensitive to heat, to hot or cold temperature. And while patients have those symptoms, they always difficulty with fine motor skills, such as writing, or unbuttoning, or picking up small objects, small articles. And those symptoms usually symmetrically among our 4 extremes, and they are always progression from distant to our to near the body. Okay. Progression toward the body. And there are many chemotherapeutic agents that will cause the neurotoxicity in our clinical practice. Most of them will cause sensory and motor nerve disorders, while seldom cause defects in autonomic nerves, and it is dose dependent. And while higher doses of chemotherapeutic agents, they will cause severe symptoms among our patients. And we selected our groups among breast cancer patients who received chemotherapy include paclitaxel and docetaxel, and they complete whole the regimen and progress of chemotherapeutic agent. Okay, those are depiction of the typical glove and stocking distribution of chemotherapy-induced peripheral neuropathy symptoms, with putative targets for CIPN toxicity in the peripheral nerve systems. And those figures depicted from the dorsal root ganglion to axon or axon components, such as myelin, microtubules, mitochondria, ion channels, and vascular network, and the distal nerve terminals. They were all defected, were hurt from the chemotherapeutic agents. Nowadays, there are there are a few strategies, few medications in prevention and treating CIPN. And the only recommended medication for treating CIPN is duloxetine. And it was accepted by the American Society of Clinical Oncology. However, it is not universally applicable to all patients and has limited efficacy in persistent CIPN. So, therefore, we would like to design an effective treatment model by using manual acupuncture to relieve pain and numbness of CIPN. On the basis of the belonging reasons, because CIPN is a refractory and disabling side effects, and there are few effective treatments, and acupuncture might be a promising treatment. And until then, no RCT using the objective assessment tool to evaluate the effectiveness of acupuncture on CIPN. So we would like to perform a randomized control trial with an objective assessment tool to evaluate the clinical benefit of manual acupuncture on CIPN. And we use the Siemens Winston monofilament to take as an objective assessment and to test the beneficial acupuncture on the CIPN. And the recruitment period of our study lasted for 2 years, from 2018 to 2020. And we recruited 269 patients, but however, there are 249 patients. Among them, they did not meet the inclusion criteria or declined to participate. So we randomized 20 patients in our study, and 10, and we randomized 10 in each group. So this is a single center study conducted at Annan Hospital. We randomized the eligible patients to 1-to-1 to each group, and the allocation ratio is 1-to-1 allocation ratio. And we separate from acupuncture group and the Chien acupuncture group. And in the Chien acupuncture group, and they received minimal needle intervention. A minimal intervention is skin deep. They also receive acupuncture treatment, but it's only skin deep and have no qi sensation. Okay. And each patient will receive 15 manual acupuncture treatments within 9 weeks. And they will include twice a week for the first 6 weeks and the 9th a week for the next 3 weeks. And we assessment for 4 times at baseline and the 3rd week and the 6th week and the 9th week. And actually we have subjective analytic method and the objective analytic method. And the subjective analytic method, we use patient-reported outcome. They include pain severity and the neurotoxicity questionnaire and the quality of life. And another one is objective tool, that is our monofilament test. Okay, so we included the adult breast cancer patients, and they were stage 1 to 3 breast cancer patients. We did not include phase 4 because the condition is more complex and more than we can imagination. So we included patients from stage 1 to stage 3. And all of them complete chemotherapy, and they have the symptom of CIPN. And we include the patients who have diabetic neuropathy, and we excluded the patients who pre-exist peripheral neuropathy disease that caused by the spinal disorders. And we use those acupuncture points that include large intestine meridian 11, and large intestine meridian 4, and the pericardium meridian 6, and conception vessel 6, and the stomach meridian 36, and the spleen meridian 6. and they are all nourishing our qi and blood. And in briefly, we included the positive finding in our study. I will report here our positive finding, and the primary outcome in our study is the average pain severity in this brief pain inventory short form. And in this inventory short form, they will also analyze the general activity, the mood, or the sleep status among our breast cancer patients. And this is the tool that is as an objective measurement to our participants. Okay. And we analyzed 8 points among our 4 extremes. They include the fingertips and the palms, or the toe tips and the plantar among our 4 extremes. In our statistical analysis, all the patients were participants and study testers were blinded, but the acupuncturist and the statistician were aware of the randomization assignment. And we used the non-parametric analysis in our study. And among the two groups, they are all comparable. And we included the parameters such as breast cancer stage, type of chemotherapy, and cumulative doses, or ECOG stage, or severity of CIPN and interval from the end of chemotherapy to acupuncture treatment. They were all comparable and show no significant differences. And as in our result, and we can reveal that acupuncture alleviates the average pain severity not only in the acupuncture group, but also between groups at the end of our intervention at week 9. And also at week 3, we can see that acupuncture alleviates pain interference on general activity and sleep during our whole treatment, and it has significance between groups. And in the objective result, and we can find that in our acupuncture group, the mechanical touch perception threshold were improved in our acupuncture group. The higher the scores, the worse the symptoms. So while we do only manual acupuncture, not electrical acupuncture, we can improve their sensitivity among their 4 extremes. Okay. And this is the changes in the mechanical touch pressure perception between groups. They have also significance in our middle fingertips and the foot toe tips. They have also significance between our acupuncture group and the sham acupuncture group. So I think there is information transferred from this present study, and I think it's our first RCT that confirmed that manual acupuncture can also alleviate neuropathic pain in patients with cancer. And I think it's the fact of acupuncture on CIPN is improving the touch sensory nerve sensitivity using an objective measurement, such as the monofilament test, and they can approve that. So our team is warranted further larger scale clinical trials. So we executing a multi-center randomized control trial to validate the efficacy of CIPN with the same objective tactile sensory assessment tool. And we collect patients from Taipei, Taichung, and Tainan. And now we are recruiting, and the study is ongoing. And we now the total recruitment subject will be R55, and we are the study is ongoing. We are games taking efforts on it. Okay, and thanks for your listening, and thanks for sharing my brief presentation. And welcome to Taiwan. Thanks everyone.